I'm reading this column here and this article, the study, this guest columnist, and it's very, very interesting. And less than half of our state's eligible population is fully vaccinated. And please don't worry about who's. I'm calling on either one of you. Just jump in here. But you guys have 41%. Is it up to around 48%, or what is it now? Anybody?
This is Megan. I believe it is up a little bit higher now in the last couple of weeks, which is exciting news to hear, certainly. But we would love to get that number even higher.
Do we know what it is? Is it near half now?
I will. Give me 1 second. I will look that up.
All right. While we do, Ann, let me ask you, we're talking about, you mentioned in here that access is not about facilities. You said the Mississippi State Department of Health has done a tremendous job of equipping local vaccine distribution sites. So what is the problem? Where do you see the problem as far as the reason? Let's talk about access, first of all, as far as access is concerned.
Sure. So one of the key barriers that we're finding in terms of access, right, knowing that there's lots of other reasons that folks don't get vaccinated, is that much of the vaccine rollout happened online. And as you're likely aware, and many of your listeners are aware, is our state struggles a little bit with broadband access and getting online. And one of the stories that we consistently heard from the community partners that we work with is that, you know, if they didn't have internet in their home, actually getting an appointment to get a vaccine was incredibly difficult and a barrier for many of them getting the vaccine. They eventually gave up.
But I got to ask you, and I'm thinking, when you said that, I'm thinking of places like Wyoming or Texas, in other areas that have a large rural area too. Are we that much different than other states as far as the same type of access or lack of access?
I think one of the differences is most of our population lives in a rural space, whereas in some of those other states, they have pretty large urban centers. And so their rural spaces actually aren't as populated as our rural spaces.
But most people have it's either a Clarksdale in the Delta area or a Cleveland or a Batesville or some area like that. I'm struggling to find out where people don't have any access, or in other words, they wouldn't even have the ability to use, in most of these places, a smart device at all because there's no Wi-Fi.
Yeah, so that's one of the things that some new data from the American Community Survey is telling us is that, and these are self-reported, but that there's, you know, more than half of our counties, at least 25% of households have what they're calling low internet access of any kind. So that means they don't have a device, a computer, a smartphone, a tablet, or, you know, and those are the devices that they would use to access maybe public Wi-Fi at a coffee shop. And layer that on top of the limited sort of broadband subscriptions that we have in this state, and that initial rollout of the vaccine appointments was really difficult for these communities.
So, Megan, what that would mean is they could get the information on television or radio or whichever way they got it, maybe at the church service, or whichever way they possibly got the information, but they couldn't act upon that because they had no availability or inadequate availability as far as Wi-Fi is concerned or broadband.
Yeah, that's definitely true we think, at least for a lot of places in Mississippi. And I think that, you know, access certainly plays an important role, but we also have heard through the news and other places as well that there's a great deal of hesitancy around getting the vaccine, even, you know, aside from the issue of access, right? So this is an incredibly complicated issue that one, you know, the issue of access, the issue of hesitancy, the issue of getting the right information to the people as quickly and as efficiently as possible are all layering on top of each other, resulting in our not being able to have as high of a vaccination rate as we might otherwise like to
all right,
get.
I understand that hesitancy, but I don't want to leave the assets or the facilities behind too fast here, because I want to go back to that. Don't we, and I don't know this, don't we have those community health centers out there? Are they just totally gone away, or do we still have these small rural places that do have a community health center in some of these spots?
We do, and those health centers have done a tremendous amount of work, because I don't want the fact that there is sort of limited access to overshadow the remarkable efforts that these community health centers have done in getting word out and trying to get folks into appointments, particularly early on in rolling out the vaccines. They were tremendous partners.
Here's what the research tells us. You write here are on this column: reasons for vaccine hesitancy includes concerns for side effects, long-term health effects, lack of trust in vaccines. I agree with all of those, and I mean that crosses racial lines and economic or socioeconomic lines. Would you not agree with that?
Yes.
So, what's the solution?
Definitely.
So the solution.
So we actually have a group of.
Go ahead.
Go ahead, Megan.
Megan,
No, I was
go
going
ahead.
to say, we actually have a group of students that are working on answering some of those questions right now with us, right? And to understand kind of what are the mechanisms around those issues of hesitancy so that we can begin to address those with the folks who are on the fence about whether or not they want to get the vaccine. They've heard some, potentially frightening stories about those side effects, have concerns about the long-term implications of this vaccine, and working with people in our state so that we can understand those concerns better and then develop communications and campaigns around those specific issues and concerns, so that we might address them in a way that helps people get to the decision of being able to get that vaccination.
Well, from what I understand, we have a large percentage of the adults in the state. Most of the older population is vaccinated, said Dobbs, which is why the state is seeing more hospitalizations with young age groups, 30 to 40 years old, and I would think younger than that, than before, since those younger age groups are less vaccinated. So how do you get that information? Because these are the people that are getting a lot of their information, not so much on radio and television as they are from social media.
Yes, so that's part of the strategy around this research that we're working on, is getting those folks to the table and working through the messaging that they're finding. So currently our students are actually pulling a lot of the ads and the messaging that those folks are seeing, and then asking them, what about this resonates, and then helping us understand how do we not necessarily counter that narrative, but provide a narrative that addresses the concerns that that messaging brings up for those individuals.
Okay, well, either one of you, though, when you talk about counter the message, you almost have to. I'm thinking of someone who is 22, 23, 24 years old in that age group. When you could go to them and say, look, the shot's not going to hurt you. Here are the side effects, statistical data, here it is. And I'm thinking you probably have an attention span on that of about 25 seconds. You almost have to go to them and say, look, here is one of the reasons that you're getting this, who you are getting this information from. And I know, talking to some people, when you tell them or show them the amount of coordinated effort to just go in there and confuse you, and they understand that they have gotten tainted information. Sometimes that's more so than just telling somebody, look, the shot's not going to hurt you. But I think young people, the ones who are intelligent enough to look at the information and say, okay, this has been a coordinated effort to turn us against each other or to give us false information for whatever the political reason, financial reason, or whatever it happens to be, or religious reason for that matter, which I want to broach with you in a moment or two. And you also say a lot of this is amplified by systemic racism, and I want to know where that comes from. We'll continue very, very much. Let me get back with Ann Kafer and Meagan Rosenthal, and we're Rosen. Did I pronounce the name right?
Yes. Move on.
All right. I just want to make sure. And I was looking at some numbers here, and I saw in Forest County we had 12,836 cases, since the totals have been kept. Jones County, we've got 12,994. Forest County, 12,836. 231 people have died from related to COVID in Forest County. Jones County, 215 people have died. 12,994 cases. Bolivar County, 5,920 cases. 143 people have lost their lives related to COVID in Bolivar County. And I'm thinking here, how do we not know about this? How do we, one way or the other, because we've been dealing with this now a year and a half. So I just don't understand how people are still in a vacuum to understand the seriousness of the disease to some people, and the remedy of that is getting the vaccine, Ann.
Yeah, well, uptake of new technologies is really complicated, and it's it's easy. I'm vaccinated, and I know you've been a real advocate of vaccinations online. And while we can say yes, everyone should be vaccinated, new technologies, regardless, right? Vaccines, whether you've had vaccines previously, it's complicated. And the example I keep going back to, so my research on technology adoption. So it was looking at agricultural practices. They weren't new practices. Mm-hmm. They weren't particularly difficult. They weren't scary practices, but they weren't being utilized by the community because the folks who were rolling out the practice, who were teaching farmers about the practice, had a contentious relationship with some of the farmers in the community. And so it had nothing to do with the actual technology and everything to do with the trust that they had in the messengers. And so this is a layered thing, right? It's about media and how people are interpreting the side effects. It's about the messaging people are getting about, my hairdresser told me that she's afraid that it will make her unable to have children. And so there's a lot of information out there, and it's not as easy as simply getting the vaccine, as much as we would love it to be that easy.
Do you think this, Meagan, is a new phenomenon that didn't happen in previous, because I know we've also had the people who are for or against vaccinations. It's been there for a long time. We've brought it up on the show for many, many years. But do you think this is a recent phenomenon as far as this divisiveness on a vaccine?
I mean, so I think to a certain extent it is a function of the time in which we live to a certain degree. I think there's always been some degree of hesitancy around new vaccines as they've been rolled out, but I think our current environment, and before we went on the break, you pointed out some really good things around, the issues of politics, the issues of the various divides that we see in our state and around the country are all playing into that and amplifying, the concerns and the fears on both sides of the kind of vaccine divide that we're talking about here. And I think one of the important things that Annie's example points out is that moving the needle on increasing the number of people that are getting the vaccine is, and you pointed this out as well, not really necessarily always about just the data. It's about that relationship building and that coming to the table and hearing each side out, regardless of our feelings about whether or not they're right or wrong, and then finding a way to move forward together. And that takes a lot of work and time and engagement, but it's those opportunities to hear what the person on the other side of the table is saying, understanding and honoring that, and then moving forward together.
I sincerely believe that if this were the yellow fever many, many decades ago, but we had the information out there that there was a vaccine, I think we would be more successful than we are now. So what's the difference? We have media out the wazoo that we didn't have then, and it's exacerbated the problem. So I don't know. It's one of those topics that we could talk on and on. I didn't get a chance to ask you about the systemic racism, but I would guess that the larger percentage of people in this state who are not vaccinated at this time is African Americans. Is that true?
Actually, the vaccination rates across race are actually about the same.
It is still about the same. Ladies, if you happen to be in the area, stop in. We'll continue the conversation on the air in the studio. I thank both.